Welcome everybody to Lessons from the Field. As you know, this is a series of interviews that we do with a diverse array of guests, all of whom have a common thread, and that is a passion for pharmacy or pharmaceutical sciences. Today, we're really fortunate to feature Sara Vayvayan, who is a graduate of our PharmD program in 2016. She's a licensed pharmacist in California, apparently also has a dog in the background, and, and is a senior consultant at Blue Matter, which is a consulting company that works with pharmaceutical companies on product development. And she'll tell us a lot more about that. So I'll be asking Sara a number of questions as we have in the past. Hopefully her insight will be very valuable to those listening, our students and early graduates and alumni and friends. And so let's go ahead and get started. Sara, maybe we could just start by giving us a brief walkthrough of your career since you graduated, or what's happened since you graduated.
Yeah, sure. So once I graduated UIC, I actually moved back to California to study for my boards. I wanted to pursue a career in the pharmaceutical industry. Actually, my preceptor at Baxter heard that I was looking for industry opportunities, and she asked me if I'm willing to move back to Chicago. So I moved back to Chicago for a year and a half. I worked at Baxter as a regulatory affairs associate, but then I wanted to get exposed to the commercial side of pharma. And my friend used to work for 1798 consultants at the time. And she told me about how they do a lot of market access. And I was very involved in AMCP in school. And so my background in PNT and everything, it was kind of aligning to what I would want to do in commercial. So I was at 1798 for almost 3 years. A few weeks ago, I recently started a job at Blue Matter as a senior consultant. They are not primarily focused on market access. They are more involved in like brand and life cycle development and new product commercialization, but they're also trying to increase their capabilities in market access.
Okay, great. Well, before we go on to the other questions, let me, what you just said, maybe let me just prompted me to a couple
Sure.
other questions. One is just to make the point that you mentioned Baxter. You did a clerkship, right, as your P4 clerkship at Baxter, and so obviously the folks that you met there, worked with, were quite impressed, and you were able to land a job there after graduation. So
yeah, definitely.
Power of networking.
I could touch on that a little bit. I did apply to fellowships my 4th year, but I wasn't able to secure one. And part of that was because I was limited in the locations I wanted to move to. I really wanted to go back to California. But that is a really good point, because I think that your rotations could be a segue for an entry-level role. And I think students should take that into account. Yeah.
Great. That's a good, glad we were able to make that connection. And then 1798, was that the name of it? Okay, sorry. I'm thinking of the Mayflower for some reason, but it's a consulting firm that works with pharmaceutical companies to help them with market access for their products. Is that right?
Yeah.
Okay.
So I mean, both companies, we work with like small, medium, large pharma, some device companies, some diagnostics, but a lot of the times it's just like, it could be like one-off projects where they just need help with building like their patient support program for a specific product, or it could be all the way from like brand planning for the entire year for like their oncology portfolio.
Okay. Okay. Excellent.
Yeah.
Well, the next question we usually like to ask our guests, regardless of where they're working, because it helps our students and others get a little more detail on like what do you actually do in a day. So maybe you could share with us like your day-to-day activities, the kinds of things that you're involved in.
Yeah, sure. That's kind of a hard question in consulting, because in consulting, your day-to-day could change. And I think that's what got me interested in it. It's not repetitive. You're usually on like 2 to 3 projects depending on your role, but it's a lot of client communication and talking to clients directly and asking what they need. Or for example, they need to do like a pricing landscape for a specific therapeutic area. So it could be all comprehensive market access. It could be like, we need market research designed for payers or providers. It could be, we need like an entire competitive intelligence or competitive landscape deck to figure out who else is in this therapeutic area that we're trying to target. So it's a wide array of different asks
Yeah.
that you figure out on the job.
It sounds like you're really using your clinical skills though in
Yeah, you do.
quite a bit.
Yeah.
While people think about consulting or some of these jobs as not being as clinical as say direct patient care, really in many ways they are.
Yeah. I would say it's kind of split. Some people don't have a healthcare background and they go into consulting, and some do. And it definitely helps to have the scientific background because we already understand the therapeutic area. We learned that through our curriculum. So we understand the mechanism of action of drugs and what's going to be able to differentiate their product from what else is available in the market. So it's definitely helpful.
Yeah. Well, I know you mentioned earlier that you were interested, I guess, early on in pharmaceutical industry. Was there something specifically about consulting or the consulting side of industry that you were especially interested in, or tell us more?
Yeah, sure. So I actually had a consulting internship during pharmacy school. So Mags told me about this opportunity in consulting. It was at Siegel Consulting in Chicago. So I did I think it was like a 4 to 6 week internship with them. And it was a pharmacy benefits intern. So it was more focused on like health plans versus like directly working with pharma. But yeah, that's what sparked my interest in consulting. And then being involved in AMCP, just seeing all of the different speakers come in from non-traditional fields of pharmacy is what made me want to go that route.
Yeah. Okay, great. Let me just interpret for the audience a little bit. Mags it's a reference to Dr. Margaret Bune, who is the advisor for the AMCP chapter at UIC. So good shout out to her. So I guess maybe, I don't know if I just answered this next question, but we were going to ask, during the time you were here, who were the faculty that influenced you along this pathway?
Yeah. I would say Dr. Bayun, of course, being involved in AMCP and taking her elective course, as well as Dr. R. Dr. R was the faculty advisor for my fraternity, and she really helped me with like my leadership skills and being able to manage people, which will take you pretty far in life.
Good. Okay. Well, thank you.
Sure.
So I guess related to that, what else about your time at UIC helped you prepare for this career? I know you mentioned a couple courses and some of the faculty. Is there other aspects of the PharmD program that you feel like that maybe students should pay particular attention to or might be particularly helpful?
Yeah, definitely get involved in the organizations. UIC has a lot of organizations geared towards anyone's interests. And get involved, reach out to people who are in the fields that you want to pursue. And then aside from that, I guess like all of the rotation options the school provides, I think that was also one of the reasons that UIC stood out to me. The opportunity to get involved in like industry and other fields of pharmacy.
Okay, great.
Sure.
Just taking a couple notes here. Sorry about that.
No worries.
Helped prompt me for additional questions. So I guess, so going from UIC then to what you've been doing in your career, I guess as you look back at UIC, you've already kind of mentioned some of what influenced you, but what does UIC pharmacy mean to you? Is there anything that jumps to your mind, or something
Yeah.
that can help in how we market, since you're an expert in that area?
I would say, going back to my point about the opportunities that the school provides, the research, the innovation, and aside from that, it's your entire class becomes your family. I think there are still a lot of friends from my pharmacy school class that I still keep in touch with. And the time you spend together after those 4 years, like, builds a bond that you probably wouldn't get anywhere else.
Yeah.
So it's definitely the family and the friendship vibe as well.
Great. Yeah, and I hear that so much. And you see it in our alumni who continue
Yeah,
to be friends for a lifetime.
exactly.
So, well, I guess when you spend 4 years in one room together,
Yeah,
you're
definitely.
best friends or worst enemies.
Yeah.
So thinking about our current students, at all stages, or we just have students start today. This is day one of the fall semester for our incoming P1s, and all the way up to our P4s, who are of course out on rotations. I think they're starting their 4th module already. And then we have folks that have graduated recently that might be listening. But what kind of advice would you give to those who are following in your footsteps, I guess, in addition to what you've already mentioned about opportunities and so forth?
Yeah, sure. Probably to just be proactive, to not be afraid of a door closing like had previously happened to me, because I feel like a closed door doesn't define your future. You need to just keep moving forward, think of a contingency plan. There's always a way to figure out how to get out of your current situation professionally if you want to keep progressing.
Mm-hmm. That's great. And I know we always like to ask people to pass on other advice they've received. You've interacted with a number of faculty, obviously, when you're here, but over your career so far, you've worked with a couple different companies, 3 now, and probably had different bosses. Is there some good advice someone else has given you that you'd like to pass on?
I think the best advice I've received professionally is to ensure you have a good foundation and you understand the basics of your job, because 10 years down the line, if you don't understand the basics of your job, that's going to haunt you in the future. So, whether you're starting a new company or you're starting out at your career, just don't be afraid to ask questions, to learn, because that is your time to learn.
Good. And while I have you, let me just also ask, because we don't have that many people who are in smaller companies, startup companies like this. Is there some particular about this type of company or working in this environment that you find particularly intriguing or motivates you, as opposed to you worked at, was it Baxter or?
Yeah, sure. That's a good question. I feel like for me, it depends on the company, but I guess the perks of a smaller company would be that you're kind of helping to build the future of that company, and your ideas and your input is taken into consideration. So you get to have a bigger voice than you would in a larger company. Yeah,
that's obvious, and must be very rewarding.
Yeah, definitely.
As long as you give them good advice.
I try to.
I'm sure you do. Well, it's great to see you have done so well, and I know you're from California, so must be nice also to be back home and everything.
Yeah, I don't think I'm leaving again.
Well, hopefully you come back and visit us at some
Of course.
Yes.
That I will do.
Okay, sounds good. Is there any last things you'd like to talk about or say to the audience?
No, I would just say, if anyone's interested in consulting or market access, please feel free to reach out. I'm always a resource if you need any guidance or help.
Good. Well, we'll share your contact information with anybody who asks.
Sounds good.
Sara, we really appreciate you taking the time to do this with us, and I'm sure we'll have a lot of students interested in this, so we'll be following up. So thank you.
Perfect.
So hold on,
Thank you,
Sara.
Dean Schmuck.